Today we have Warren Gilbert in. He's a 62-year-old male, born 5/28/1957. His vitals are a temperature of 98.5, heart rate 70, respirations of 18, blood pressure 130 over 85, O2 sats are 99 on room air. He weighs 170 pounds. He is 5'11", and his BMI is 23.7. He comes in today with the chief complaint of difficulty speaking and muscle cramping. He presents with his wife, and he originally presented to the ER about 1 month ago with these concerns, and at that time the cardiologist believed that he was having a TIA, which has since been ruled out. So he is here today for follow-up to figure out what's going on. His wife noticed that he had started slurring his speech about a month ago, and he has had difficulty talking, which is affecting his job. The symptoms came on gradually and just continually get worse, but it's not associated with any facial weakness or drooping. He reports some occasional dysphagia. He's also having muscle cramping that seems to be occurring at night, and it's making sleep difficult. It's occurring mainly in the hips, hands, jaw, and neck. He rates these cramps as about an 8 out of 10. He denies any changes in sensation, numbness, or tingling. Although he has some increased weakness and changes in balance, he's fallen a few times while playing in the yard with his grandchildren, which is unusual for him. His other complaint is diarrhea, which is well managed with over-the-counter laxatives. His wife has also noted that he's had some mood changes and will start crying or laughing for no real apparent reason. Past medical history is significant for hypertension, hypercholesterolemia, hypothyroidism, and exercise-induced asthma, all of which are managed with medication. He had surgery about 30 years ago to remove a right-sided acoustic neuroma. Otherwise, he does not have any allergies, and his immunizations are up to date. For family histories, father passed away at 41 due to tuberculosis. Mother passed away due to old age. Brother is healthy. No other family medical concerns there. He's a software engineer. No tobacco use, just occasional alcohol use, a few beers per week, 1 can of soda per day. He eats a well-balanced diet and likes to go running and walking with his wife. He was in the Marine Corps during the Vietnam War and has had exposure to Agent Orange. For review of systems, denies any fevers, chills, unexpected weight loss, or night sweats. He does complain of past significant head trauma as a child and while in the military. He has had some tinnitus since his acoustic neuroma surgery about 30 years ago, also complaining of dysphagia. No changes in hearing though, no hoarseness, no rhinorrhea. He does complain of constipation, but no abdominal pain or nausea and vomiting. Neurologically, he complains of a change in balance, complains of dysarthria, weakness, and muscle cramping, but no dizziness, numbness, tingling, change in gait, anything like that. And then psychiatric, there is a mood change, but there's no depression or anxiety noted there. So head and neck exam were performed. Overall, that was pretty unremarkable. A musculoskeletal exam was performed, and the really only remarkable thing there is that the hands are slightly stiff and have a decreased range of motion, the right greater than the left. And then there is also decreased strength in the extremities bilaterally, again, right greater than left. For the neuro exam, no evidence of foot drop, shuffling, loss of arm swing, anything like that. Memory does not appear impaired. Speaks at inappropriate volumes, but does sometimes slur his words. Cranial nerve testing was negative, except for some dysphagia was noted, as well as some tongue fasciculations. Patient has trouble with rapid tongue movements as well. Otherwise, all cranial nerves were normal. DTRs were slightly hyperreflexive, rated a 3 out of 4. And then the Babinski reflex was present bilaterally. Sensation is intact. And so, based off of the medical history and the physical exam, my suspected diagnosis right now is ALS, Lou Gehrig's disease. Some differentials would include multifocal motor neuron disease, and then that could be ruled out with an antibody GM1 test. Otherwise, another differential is benign fasciculations, and with that one, we'd be able to rule it out because it would have a normal electromyography, whereas ALS would not. Myasthenia gravis can be ruled out with acetylcholine receptor antibody testing. Hyperthyroidism is another differential, and that can be ruled out with a TSH test. And then a general brain tumor, either benign or malignant, can be ruled out with imaging. And so any of those would be ordered if I was super concerned that it may have been one of those. Otherwise, what I would like to order is an electromyography to see the nerve conduction studies. In ALS, those would be decreased, and as well as a CPK level. And then with ALS, those would be increased. I would also get a CBC and a CMP just to rule out any infection or electrolyte abnormalities that may be going on and contributing to some of his symptoms there. But assuming that the diagnosis is ALS, for treatment, what I would start him on is Riluzole 50 milligrams 2 times daily, as well as refer him to neurology, where he will need a multidisciplinary approach, including PT and OT, and a lot of different therapies in that regards. So yeah, if my preceptor is agreeable to my diagnosis as well as the plan, then I'll go into the room and explain to the patient what we're thinking it is based off of the testing, and explain to him my treatment plan and go from there. Thanks.